When you think about the scale and the impact of loneliness, it's not actually that surprising that governments are increasingly recognising that we need to do something about it. Millions of people of all ages and from all backgrounds already felt often or always lonely before COVID. And the pandemic has made it worse for many. Almost 30% of Welsh adults have told us that they hadn't had a meaningful conversation with someone in a fortnight during the pandemic. And a similar proportion are concerned that their loneliness will only continue to get worse.
I am a young person who has experienced loneliness, and it's a topic that a lot of young people find really difficult to talk about because there's so much shame and stigma around it. Young people don't want to say they're lonely because actually their experiences are sometimes different to the loneliness that we talk about. So for me, even before the pandemic, I'd experienced a lot of loneliness, just in the sense that I felt like I didn't belong to a community. There was people around me. I wasn't physically isolated. I had friends. I had people who I spent time with, but actually I still felt lonely.
Loneliness isn't new. It certainly existed before the pandemic, and it will continue to do so after the pandemic. But we must continue to build on what we know. We are not starting from scratch in any of this. There's an awful lot of evidence that we can draw on as we go forwards.
But the fact that loneliness can touch almost anyone and affect almost everything can sometimes make the idea of addressing it feel overwhelming. But while there is certainly no silver bullet solution to loneliness, the solutions are actually much simpler than people think. For example, through our own social prescribing link workers services, we've seen just how far simple, one-to-one, person-centered conversations and a little bit of trust and time can go into building people's confidence and independence and encouraging them to connect.
But there's so much to learn from the innovation that has gone on in these last few months and recent times. COVID has accelerated the experience of loneliness, but accelerated how people have responded. And we've heard so much this morning about the importance of collaboration, flexibility, and trust in how we move forwards.
The big problems we needed to solve, the big innovation challenges for us were firstly, how can tech allow us to replicate an in-person service and not lose the essence of what's good about it? And secondly, how do we overcome those issues of accessibility, skills, and affordability, which, if you like, are comorbidities for loneliness in much of our customer base?
You know, with a shift in our services and relationships moving across to the digital realm, those who were digitally excluded were at risk of becoming even further isolated. Various schemes were established that put digital devices into the hands of people who could benefit from them, together with the additional support to build the digital skills needed for people to get the most out of it, whether that be accessing vital services, staying in touch with friends and family, or developing new friendships. And our lifelong learning team played a major role here, and everything was free. There was no cost, and they spent a long time supporting people, as did many of the projects, helping people, because this was a sort of new era thrown upon us.
And we've also been experimenting with a solution for just breaking down those barriers to access, which again, we're prioritizing at-risk groups for loneliness within. It's a collaboration with Hafod, the environmental charity, and O2, whereby we redistribute disused smartphones and other technology to people who need them for various reasons, together with generous data and mobile packages, but with absolutely no strings attached. And we're just finding that this really simple intervention is making the difference for people who are otherwise getting deeper into isolation and at increased risk of experiencing loneliness, whether that's down to finances, confidence, or some other kind of barrier.
So from there, I kind of was like, what is going on here? And had a couple of conversations with young people who were saying, actually, we're not in the spaces that we were in before. Schools aren't open. I'm stuck in the house. I can't go to my youth groups or my youth clubs or the places where I feel like I belong. And so that's where I chose to do something about it. So in March of 2020, I set up Project Hope. And it was a project that was just a group of young people. So I reached out to some young people who were just in my networks. So a group of about 20 young people who I led got involved, and we ran sessions for young people who were aged 13 to 25, which were online sessions, and we did all sorts, open mics, games nights, creative writing, you name it, we probably did it at some point. We ran over 90 sessions in the past year for young people, completely led by young people. We have no adults in the team, apart from those of us who are over 18 but under 25. And that's just the way that we've done things all the way through. So we've run all sorts from the sessions, but also we've done awards ceremonies for young people who are making differences in their community, as well as youth-led conferences, so that we can give that platform to young people to talk about the issues they care about.
SCVS is wanting to harness the support from the voluntary sector, and the overwhelming support that came forward from within our communities was just unbelievable. Volunteers were trained and supported to be in a befriending role to meet the various needs of people. You know, we had a hospital discharge scheme established to ensure that when being discharged from hospital during the pandemic, you know, people could be introduced to, with checks in place to ensure that people had access to food, the support they needed, because, you know, being unwell and on your own as well and isolated at home or whatever was going to be even harder.
For initiatives like this to work well, we need a whole ecosystem equipped to support connections. People need access to technology for information and advice. They need transport to get to places. And many need a thriving voluntary and community sector to provide the types of community activities and events that they might rely on in the future to meet other people. When thinking about policy and practice solutions, I always find it really helpful to break it down and think about loneliness as numerous drivers which take place at a range of levels. So at an individual level, someone's sense of self, their health, income, and habits can all impact our connections. At a community level, things like a lack of available, accessible, and affordable social activities, spaces can contribute to loneliness, as can things like inadequate transport infrastructure. But we also know features of UK society can play a role, such as social and cultural norms like stigma, prejudice, discrimination, as well as the rise of online and digital engagement. When we think about it in this way, it's clear we A, all have a role to play in tackling it, and B, collaboration across organisations, sectors, government departments and communities is absolutely essential.
Well, all agencies moved heaven and earth to redeliver services during COVID, and that led to a lot of new ways of working, which I think we ought to celebrate where it's worked well. And some of these kind of emergency hubs where people have come together, which has been kind of a one shop for people to access help, but then has been an opportunity for people to be referred to the right place, to the appropriate person that can help them best. And I think that's something to take forward as well. And this longer term collaboration and partnership working. No one organisation can fix this. We've got to work together. We've got limited resources. It's even more vital.
Much of our understanding has been formed around an outlier, if you like, a situation in which there was enforced isolation and loneliness, if you like, and that amplified risk factors for many people already at risk. So while tech certainly has some promise in the world as it's become since COVID, what role does it have in getting people reconnected and confident in a post-pandemic world, if we dare to think of one? How will it combine with non-tech-based solutions, for example?
Yeah, and I think there needs to be that acknowledgement that we are in another position of another time of transition, and that as restrictions are beginning to be lifted and we begin to find out exactly what the impact has been for the wider community, I think there's a bit of a risk, not within this community, but you begin to hear it in the wider community, of competition between the people who've been affected. I think we need to do an awful lot to counteract that. Everyone's been affected, but in different ways, and they need different different ways of approaching that. And I think that's something we need to really work together on.
In the immediate term, there's a strong case to be made to invest in confidence building and reintegration support for people who've been particularly isolated and impacted by COVID, particularly now with restrictions easing. And finally, we need to do more to overcome the structural and cultural barriers to connection through, for example, improved transport and investment in public places, and of course, closing the digital divide that has been so tragically exposed throughout the pandemic. We now just need to work together to make that happen in practice.